8:14 on his Thursday morning. Getting enough sleep's vital in maintaining good health. But 1 in 3 adults consistently get less sleep than is recommended. Dr. B joins us now, our friend, Chief Medical Officer at People's Health, to discuss the importance of getting enough sleep and to give us some tips for maintaining a healthy sleep schedule. Morning, Doc. How you doing?
Hey, Tommy. I'm doing great. How about you?
Good. How'd you sleep?
I actually did pretty well last night.
Good. How much sleep do we need?
Yeah, so a lot of people don't realize, but all the experts recommend that you really get between 7 and 9 hours of sleep every night, and that can be a lot for some people, But really, the amount of sleep that you need can change throughout the course of your life. So, younger kids sometimes sleep for longer. As you get older, sometimes that amount decreases a little bit. And it's going to vary from person to person as well. But really, kind of the important thing to remember, it's not just the hours spent in bed. There's really 3 major elements of healthy sleeping. And, the first is getting enough sleep, that's 7 to 9 hours. The other one is really getting quality sleep. That's like a deep, restful sleep without a whole lot of disruptions during the night. And then also keeping a real consistent sleep schedule, so making sure that you have a regular bedtime and a regular wake-up time. All of those are very important.
What are some of the signs that you're getting healthy sleep?
Yeah, so getting enough sleep at night is really vital, but that quality sleep is what's really important. So when you wake up in the morning, you feel refreshed. And so the signs that you want to look for is something we call sleep latency. So that is how quickly you fall asleep. So really, when you get into bed and you turn out the lights, it should only take you about 20 to 30 minutes to fall asleep. You should sleep through the night. Some people do wake up maybe once during the night, but if you're waking up multiple times during the night, then that's a problem. And then if you do wake up, you maybe have to go to the bathroom or something, you need to fall back asleep within about 20 minutes. If not, you're not having healthy sleep. And really, like I said, that is all so that in the morning you feel rested, restored, and really energized that next day.
I would think that there are some benefits to getting good sleep, health benefits.
Yeah. Oh, yeah, absolutely. I mean, it's essential to everything, everything that goes on in your body. And, it supports your brain function. It can actually reduce risk for certain chronic diseases. It's going to improve what you do during the day, how active you are, how safe you are. And it's really going to improve your mental health. So that's why it's so critical to get good sleep.
And if you're not getting enough sleep, what happens then?
Yeah, I mean, if you don't get enough healthy sleep, obviously you're going to feel tired the next morning, but it can really interfere with your brain's ability to function, and that can have a lot of serious consequences. So, in the short term, what people usually experience is maybe reduced attention span. They may have trouble making decisions. Obviously, they're going to feel fatigued, and some people can get real irritable. You see that in kids that are real sleepy. And, when it goes much longer term, it causes a lot more problems. It can affect your memory and really the way you think, your cognitive functions. It can reduce your body's ability to fight illness. And it can actually increase your risk for chronic diseases, things like diabetes, high blood pressure, heart disease, and even stroke.
What are some of the causes of poor sleep?
Yeah, there's a lot of things that can lead to poor sleep. Poor sleeping habits are a major problem. So, that includes things like going to bed at irregular times, really having a lack of a schedule for bedtime. Drinking too much, water or caffeine, especially at bedtime, and even alcohol, that can cause a lot of problems as well. And then, people who suffer from a lot of daily stress and anxiety disorders, your mind can be really active at night, and that can make it difficult for you to fall asleep. And then certainly, people who have chronic health conditions, things like asthma, lung disease, chronic pain is a really big problem, maybe even prostate enlargement in men. That's very much associated with poor sleep. And then one of the biggest causes is actually sleep disorders, which are quite often undiagnosed and untreated.
Let's talk about that a little bit more. Tell me about sleep disorders.
Yeah, so, sleep disorders is really any condition that prevents that restful, restorative sleep. And, everybody can have trouble sleeping from time to time. That's not unusual at all. But if you're really having, regular problems falling asleep, unable to stay asleep, that's where it really is a major issue. And so some of the things you want to watch for is, if you wake up in the morning and you're really not feeling rested, even though you had a full night's sleep. One of the big ones is when people have trouble staying awake when they're not active. Somebody's sitting around watching TV, watching a movie, and they completely doze off. That can be a sign of a sleep disorder. And then people who have trouble concentrating or trouble remembering things, that can be a sign as well. And then one of the biggest ones we see sometimes is people who have trouble controlling their emotions. When you don't get enough sleep, really everything can come out, and so that can be a big problem too.
You got some examples of sleep disorders?
Yeah, there's several. The most common one everybody knows about is insomnia. And insomnia actually comes in two types. There's actually trouble falling asleep or trouble staying asleep. And that's when you're in kind of a nice, healthy sleep environment, a nice dark room, cool room. But really you can't go to bed. And it can be short term or it can be long term. The other thing that we see a lot of is sleep apnea. Sleep apnea is where you have trouble with your upper airway and it can get blocked while you're sleeping, and that's going to cause you to have trouble breathing. And, usually if you have a partner, they'll see you gasping or maybe snoring loudly. That can actually lower your blood oxygen levels during the night and cause multiple problems, and it can really cause frequent awakenings during the night. And then kind of the least common, but we do see it occasionally, is something called narcolepsy. And narcolepsy is where the brain really can't stay awake. It can't maintain that attention. And that's people that will suddenly fall asleep even when they're doing an activity. They may be working or walking, and they'll immediately fall asleep. Those are sometimes called sleep attacks. So it's rare, but it definitely does happen.
Let's take a break. We come back, we'll talk about some things you can talk to a doctor about if you're having trouble sleeping and ways to get a better night's sleep. We're talking to Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, and it is important that you get good quality sleep every night. 821 traffic now, WWL. 826, Tommy Tucker, WWL. Quickly back to Dr. Brent Wallis, Dr. B, Chief Medical Officer at People's Health. 1 in 3 adults consistently get less sleep than is recommended, and we're talking about sleep disorders and what some of the problems are, signs of healthy sleep and unhealthy sleep. Doc, should you talk to your doctor about trouble sleeping, or when should you?
Yeah, you absolutely should talk to us about, really any time you're having problems falling asleep or staying asleep. If you've got any of those other symptoms we were talking about, especially, not feeling rested when you get up in the morning. And, what we're going to do is we're going to ask you questions about your sleep schedule and habits you may have. A lot of times we may even ask you to keep a sleep diary, which is pretty easy to do. A lot of phones now have apps that you can keep track of when you go to bed, when you wake up, and if you wake up during the night. We might even order some tests, things like a sleep study, for instance, is where we observe you sleeping and actually, measure oxygen levels and what your heart's doing. The other thing, too, to keep in mind, if you're on medications for certain health conditions, sometimes there can be a side effect that, interrupts sleep, especially fluid pills, for example. That can make you get up in the middle of the night. So we're going to review those medications and see if that may be causing some of the problems.
How can we all get a better night's sleep?
Yeah, it's very frustrating if you've ever had trouble sleeping. There's a couple of simple things you can do to really help you. One of the biggest ones is avoiding caffeine and alcohol, and especially large meals right before bed. It's going to make it much more harder to sleep, and you're more likely to wake up in the middle of the night. And then another really key thing is put away those mobile devices. Everybody's on their phone all the time. There's blue light that emits from those screens that can actually disrupt sleep. And so you want to turn on the blue light filter, number one, and then really put the phone down at least 30 minutes before bed. try doing something else, read a book or listen to some music so that you can fall asleep better. And then, develop a schedule. Try to be consistent with when you wake up and when you go to sleep, even on the weekends, because a wide variety in your schedule can cause a lot of problems. And then you really do need to have a good sleeping environment. Don't try to sleep on the couch or somewhere that's not your bedroom. You want it to be quiet, dark, a real comfortable temperature for yourself. Some people use white noise machines because that can mask sounds that are happening in and outside your house, and that can help a little bit too. And then, one key thing is don't lay in bed if you are awake. If you're having trouble sleeping, you're not going to all of a sudden fall asleep. So if you're laying there for 10 or 20 minutes, you really should get up, try to do a relaxing activity, like I said, read a book. Wait until you feel tired again and then go to sleep, because otherwise you're just going to get really frustrated. It can be really hard to change your nighttime routine, but if you do it, it's definitely worth the effort. You're going to feel much better in the morning.
Do you want to exercise, work out before you go to bed or a couple hours before? Or does that depend on the individual?
Yeah, it depends a little bit, but if you exercise right before bed, those endorphins are going to wake you up, and so sometimes people have trouble falling asleep. So I tell people it's probably better to do it in the morning than at nighttime.
You might want to come to work here, Doc, because people don't seem to have a problem doing that when they're here. I'm just kidding. Thank you.
Thanks, Tommy. Have a great morning.
You bet. You too, sir. Dr. B from People's Health. To find out more about People's Health, you can go to peopleshealth.com. You can visit the People's Health Medicare Center at 3017 Vets in Metairie. Appointments are recommended, but walk-ins are certainly welcome. You can call 800-978-9765, or you can always follow People's Health on Facebook, Twitter, and Instagram. We'll talk to Senator Bill Cassidy when we come back. Right now, it's time for WWL First News. For that, we go to Ian Ozan.